Please hold while I confirm your passcode. Thank you. Your passcode is confirmed. The host has placed the meeting into a listen-only mode. Please wait for the tone. Then say your name and press the pound or hash key. When you hear the tone, you will be the 13th person to join the meeting
of Fisher & Phillips, LLP. The technology we are using today is being provided by PGI, a leader in communication technologies. PGI provides audio, web, and video conferencing services, electronic fax and document delivery service, as well as digital notifications and reminders. PGI enables the world to connect meaningfully by providing technologies designed with people in mind. Before we get started, I'm going to address some basic housekeeping issues for all of you. First of all, Josh has provided a PDF of the slides for the presentation today, and I'll be emailing that to everyone today in a follow-up email right after the presentation, so be on the lookout for that. If you don't receive it and you need a copy, please send me an email at audrey@officearrow.com, and I'll send it to you as soon as I can. If you're experiencing any technical difficulties, just press *0, and you'll be connected to an operator who can help you out. I also want everyone to know that your lines are muted right now, so just to help minimize the noise. So if you have to take care of something in your office, it's fine. Go ahead and put the phone down for a minute. There is a Q&A box where you can send questions to either me or Josh, and I'll moderate those questions as the presentation goes on. And if it's immediately relevant, I'll interrupt Josh and ask him to answer at that time. If not, we'll wait until the end of the session for the Q&A. Now I'd like to go ahead and introduce our presenter for this afternoon. Josh Norris is an associate in the Atlanta office and a member of the firm's Employee Benefits Practice Group at Fisher & Phillips, LLP. His practice focuses on a wide variety of employee benefit matters, including welfare compliance issues, cafeteria plans, retirement plans, and ERISA litigation. Josh represents employers in connection with 401k and welfare plan government audits, and he regularly deals with plan correction programs established by the Internal Revenue Service and Department of Labor. Josh also advises plan fiduciaries with respect to their obligations under ERISA, and he conducts reviews of benefit plans and plan procedures to ensure legal compliance. Josh has also authored numerous articles concerning emerging issues in employee benefits. So Josh, if you're ready to go, let's go ahead and get started with our healthcare reform.
Thanks, Audrey.
Sure.
Today I'm here to talk about healthcare reform, and specifically what I'm going to try and focus on is what is important to employers and what part they need to know about it. I'm sure this is an issue that many of you, this isn't the first time you're dealing with. It's a topic that's gotten a lot of press coverage, even during the legislative process. It got a lot of attention. As a result, there's a lot of misinformation out there. Hopefully, as I go through different provisions, I'll clear some of that up. Even today, the bill was originally passed back in March of 2010. It's still getting a lot of press today. There are several states that have filed actions questioning the constitutionality of the bill. A couple courts have ruled that it is unconstitutional, and those cases are pending appeal. We really don't know the outcome of what it's going to be. They have filed for expedited appeal before the Supreme Court, so we're hoping it does get resolved shortly. But for the time being, it is law, and some of the provisions are already effective. Others are coming into effect this year, others next year, some 2014. But we are taking the approach that it is a law, and we need to go ahead and bring compliance. So with that, hopefully I'll help enlighten you on what provisions you need to know. That being said, where do we begin? It really is just an enormous and very complex bill. It's expected to have the broadest impact of any legislation since the Social Security Act. It's really just a huge change in philosophical approaches by the government. It's extremely complex. In just sheer size, it's actually two separate bills, and it's close to 1,000 pages. The reason we have two separate bills is the Senate actually passed a previous version of the bill, so it was necessary to have a reconciliation act. This added a lot of confusion and also some of the misinformation out of there. There were a slew of publications that came out right after the first bill was passed. In that regard, I would caution everyone. I know when you have questions that come up, today's age, it's very easy to just go ahead and try and find an answer, Google it. I would caution that there is misinformation out there. You need to see the dates that the articles were written, things like that. So you definitely want to be careful. In addition to 1,000 pages of statutes, that doesn't provide us everything. A lot of provisions are very vague and call for various government agencies to issue additional guidance. As I said, the bill was passed in early 2010, so a lot of guidance has come out since then. But there's still a lot we don't know. So really that 1,000 pages is just the beginning. In addition, with the bill calling for additional regulations, it's a huge impact on various agencies like the Department of Labor, the IRS. Right now they're really scrambling just to get this guidance out and provide details as far as these provisions. But we know that eventually they're going to get around to enforcement. We still really don't know what direction they're going to head with that, but it's a good idea to go ahead and be prepared and make sure you're compliant. In addition, just to the sheer complexity of the bill, it really has a very broad impact. It affects individuals. There's an individual coverage mandate where you either have to have health coverage, you're going to be forced to pay a penalty. It's also going to affect the insurance industry. The bill dictates what type of coverage they have to provide, certain coverage that they have to have, costs, things like that. It also affects the healthcare industry. Clearly, under the bill, there are going to be a lot more people that have health insurance. And what goes along with that is there's people questioning whether or not the industry itself can actually support and provide proper care for all these individuals. As I said, it's also going to impact the government. Various agencies are required to issue regulations and also enforcement. Some examples of the Department of Labor and IRS. And of course employers. That's why many of you are here today. Regardless of the type or the size, it's clearly going to impact employers, and hopefully I'll help you understand what's important with my presentation today. Something to think about is the bill significantly expands the federal regulation of healthcare plans and insurance. And this is something that's typically been regulated by the state. So as I said, there's just a huge change in philosophy. It's the first time we're seeing the federal government step in and dictate certain terms of insurance. This really could be the forefront. Under the bill, there's still a lot regulated that the states can regulate, but we don't know how much that's going to change in the coming years. So it's just important to keep track of everything that's going on and see what happens. So what I'm going to specifically cover today, there's not enough time for me to get into every provision of the bill and talk about when they're effective and things like that. You should receive, along when you get the slides, put together a timeline that has all the provisions of the bill and their various effective dates. Hopefully that'll help out some of those provisions I'm talking about today. Others, as I said, there's just not enough time. So that being said, what I am going to focus on is really just the big picture. I'm going to go over, kind of start with an overview of healthcare reform and how it addresses its legislative goals. In order to do that, I'm going to kind of give a background on life before healthcare reform, what was going on in the marketplace, things like that, and then the goals of legislative reform and how various provisions are in furtherance of those goals. And then we move in, as I said, I will cover various provisions of the bill. I'll start with employer pay or pay mandate. That's the one that's really gotten a lot of press and employers are really concerned about. And then I'll move on to several other big ticket items for employers. Those are just really, I'm going to focus on the ones that have got a lot of press and there is a lot of misinformation out there. And then I'll move on to what's the future of employment-based health care coverage. It really is, I can't emphasize it enough, it's just a massive bill that it's just a huge change in the industry and how the government regulates it. And there are a lot of questions that employers want to know what the future is of providing health care for their employees. And finally, I'm going to wrap up with things that employers can be doing now to help prepare for compliance and issues like that. So to kind of start, I want to paint a general landscape of how the market was and various incidents before healthcare reform came along. One of the key things is that individuals weren't required to maintain health insurance coverage. that's one of the issues that really pushed why healthcare reform came around, is there were all these individuals that weren't covered, and the government felt like they needed to be. Part of that is, beginning January 1st, 2014, there is an individual mandate, and individuals must either purchase health insurance coverage or they're going to have to be forced to pay a penalty. And the penalty is going to be calculated based on what that individual would have had to pay, the cost of coverage. This really is a provision that's getting a lot of heat. I'll get to that in a little bit, but prior to healthcare reform, individuals weren't required to have health insurance coverage. Along those lines, with rare exceptions, employers are not required to provide health coverage. One of the few exceptions to this rule is just COBRA coverage, the situation when an employer has health coverage and one of the employees experienced a COBRA qualifying event, and the employer has to continue to offer the health coverage to this employee. Clearly, this is an area where they're required to provide the coverage, but if you really think about it, the employers are elected to provide coverage to their employees, and the COBRA law really just dictates the length of coverage that they have to provide it to employees. So it's kind of a different situation than what healthcare reform's created. Along those same lines, before healthcare reform came along, employment-based healthcare coverage, which is also commonly referred to as group coverage, is essentially a guaranteed issue. Now, guaranteed issue is it's kind of an insurance term that's thrown around, and what I mean by that is you can have group coverage regardless of your depending certain employment specification requirements for eligibility, but regardless of age, health factors, things like that, none of those are taken into account when you're paying your premium. It's really looked at as employer-based, and there are claims incidents that are taken account into calculating the premium for the employer, but generally all employees pay the same. There are certain situations where an employer will have different levels of employees that pay different cost share of the premium. For example, executives and management may pay a smaller percentage of the overall premium than lower-level employees. That's not what I'm really talking about here. What I'm talking about is just when you sign up with your employer for insurance, you don't have to worry about your personal claims history or whether or not you're healthy. And along those lines, another situation before healthcare reform came along is employers attempted to control increasing healthcare costs through plan design. This is another topic that's really gotten a lot of press. I'm sure many of you have experienced on a first-hand basis, is that healthcare costs are really just spiraling on an upward trend. A lot of employers have attempted to manage this cost by altering their plan design. Some examples of the way they do that are through maybe have a higher deductible, limiting certain limits on coverage under the plan, maybe switching the type of plan from an HMO or PPO or vice versa, whatever happens to be cheaper for the employer for a given year. Another thing is there are a lot of healthcare reform tools that employers have enacted, like health savings accounts, health retirement accounts, things like that. Health reimbursement accounts. And along those lines, what the employer would really do is shift a lot of the cost to employees, higher deductibles, things like that. That's really causing the employee to pay more of the cost. What employers were also doing is causing, if their premium would go up, they simply just pass that right on to the employee, and the employer would be responsible for paying that increased premium. Some other situations going on before healthcare reform, with rare exceptions, individual health coverage is not a guaranteed issue. So kind of contrast to this group coverage, when you sign up and try and buy insurance in the individual market, they are going to look at your claims history. They may require you to go get a physical, see if you have any issues. If you do, they may exclude that from coverage. Or at the very least, because you're unhealthy or have some type of issues, they may cause you to pay an increased premium. And what that was resulting in many cases, is unemployed and unhealthy have no access to health insurance. They just simply couldn't afford it, or insurance companies weren't willing to underwrite them for the issues that they needed. And what this created was a phenomenon known as group coverage equals access. In other words, you needed that employer coverage, that group coverage option in order to actually be covered. Because if you went to the individual marketplace, you just couldn't have that access. So with that background in mind, hopefully I've painted a general landscape of what things were like healthcare reform and kind of reasons on why it was on the forefront. And now I'm going to cover the primary legislative goals in healthcare reform. It's kind of three major things. One is cover the uninsured. Two, ensure that healthcare coverage is valuable and meaningful. And finally, lower, at least flatten, skyrocketing healthcare costs. So with those goals in mind, I'm going to take a look and start discussing some of the provisions and how healthcare reform achieves those goals. The first being the individual mandate. Again, I mentioned it earlier, beginning 2014, individuals will be required to purchase insurance or they're going to have to pay a penalty. Clearly, this is going to get more people to have health insurance. There is that option of paying the penalty, but because it's focused on and based on what it would cost for health insurance, it's really seen as an encouragement in getting people to have health insurance. There's also a similar coverage for large employers. It's employer mandate. They have to provide coverage, health insurance coverage for their employees. That's one of the provisions I'm going to discuss in detail below. But that's another provision that's effective January 1st, 2014. And then state insurance exchanges. What this means is part of healthcare reform is it requires states to set up online insurance exchanges where individuals can go to buy health insurance. It's supposed to be one of those things that an individual can basically shop various insurance coverages, compare them, do things like that, and just have more options. And then at the same time, the legislature felt like this was an option to keep healthcare costs down by allowing employees to shop, and it'll give insurance companies an incentive to be more competitive. Another way that healthcare reform is achieving the goal of covering the uninsured is there are several tax subsidies for lower income individuals and small businesses. So it can be those individuals that can't afford insurance or small businesses that were having financial problems of providing to their employees. There are options available to provide coverage there. And then the guaranteed issue. The elimination of several factors that insurance companies have been using to kind of get around providing coverage to those unhealthy people. And with that, it kind of overlaps with my next slide of how to make the coverage valuable and meaningful. Part of the guaranteed issue is there's elimination of pre-existing condition exclusions, lifetime limits, and annual limits. Again, these are all things that the insurance company had set up to do to kind of weed out those individuals that have a higher risk of or more tendency to provide to incur expensive claims, things like that. There's also a requirement to provide minimum essential benefits for all plans, plus numerous other coverage mandates. And what this is, it's literally minimum essential benefits as defined in the statute, and it provides things like ambulatory care, emergency visits, things like that. And so it's kind of a baseline of all coverage that will have to be provided to ensure that what's valuable and meaningful. And finally, there are the various cost-sharing limits, especially for employer-provided coverage. And in order to avoid penalties, there are certain limits on what employees can pay. So the big question is, how does healthcare achieve the goal of lowering healthcare costs? This is definitely something that's really up for debate. A lot of people argue that it doesn't lower costs, that it's not really there, but at least philosophically, what the intent here is to get everyone in the system. And what I mean by that is kind of just general insurance principles that the larger your pool of individuals, the more the risk is spread out. So you're having all these individuals that can afford health care now, and you're lowering the price, and you're getting them into the system, and the risk is being spread out. Another is the changed manner in which the health care is used. What I mean by that is part of the minimum essential benefits is really a focus on preventive health care. There's So there's this push to, when people are sick, to immediately go get preventive care or have their be up on their vaccines, things like that, rather than having to go to the emergency room. They can just go to a general health care provider. If you look at legislative history and some of the preamble to the regulations that have been issued, using this approach to lower the health care costs, even the federal government thinks it's going to take 10-plus years. Some people think even that's being conservative. There's no way to tell yet, but at least that's the intent here, and that's how it's supposed to achieve it. The big question is the cost to whom. If you're taking this approach and you're looking at it that, you're getting these individuals that can't afford it or have very high costs, and you're just spreading that risk out, then clearly the individuals that are healthy and already had coverage are going to be having some of that burden. So that's really the question, is who's going to bear this extra cost and how is it going to be divided up? So I've kind of been trying to paint a general landscape of before healthcare reform and then outline the goals of it. The big question everybody wants to know is how is this going to impact employers? Not trying to be negative, but the reality is, in likelihood, it's not going to be in a positive way. Most employers, it's just going to be higher healthcare costs. I said it's going to be at least 10 years to get everybody in the system. Even if that's the case, it still looks like it's just going to be a big burden on healthcare employers. There are all kinds of regulations that I'm getting into dictating the type of coverage they have. Along with that, they're probably going to be higher taxes. If they choose not to provide adequate coverage, there are going to be taxes imposed there. The big thing here is more of an administrative burden. Like I said, I'm trying to flesh out as much of the bill as I can, but there's still a lot we don't know. From an employer perspective, that means you're going to have to focus on what the law is now as well as in the future, and it's going to be changing. And there's just costs associated with that and changing your type of coverage, things like that. I realize that's not what anyone wants to hear, but it is the reality of the situation. It just increased cost of compliance. Another thing is employers are going to have less freedom in their benefit plan design. With these minimum essential coverage, dictating what specific benefits employers have to provide, as well as the premiums they can charge, things like that. There's not as much freedom there. Another thing we're seeing is the previous administration was really pushing this consumer-driven healthcare, like flexible spending accounts. And as I'll discuss a little bit later, the current administration, through healthcare reform, is pushing away from those. And what employers were really using this for is just more benefit design options and trying to do different things there, and that's just not going to be a possibility. So with that background in mind, I'm going to get into some of the specific provisions. To start with, it's the employer pay mandate. This is really the one that's gotten a lot of attention. Employers really want to know about it, so I thought I'd go ahead and start there. Not effective until January 1st, 2014, and it applies to large employers, and large employers are those employers with 50 or more full-time employees, and a full-time employee is one that works 30 or more hours per week. So all large employers are going to be required to provide adequate health insurance coverage to all their full-time employees and their dependents, or be forced to pay a penalty. Now, by adequate group health plan coverage, the plan is going to have to provide, again, that term, minimum essential benefits, cover at least 60% of the cost of benefits. Now, I'm not an actuary, but everything I've been told is that most employer plans do meet these first two requirements of providing minimum essential benefits and cover at least 60% of the cost of benefits. And then finally, the employee premium cost cannot exceed 9.5% of household income. Notice I didn't say just income, it's household income. So a lot of you, for employees that have family coverage, even though that premium is significantly higher, you're going to look at it in regards to what the household income is, not just for the individual. I went ahead and put up here, just to get a benchmark, the 2010 average healthcare coverage premium cost, and I got this from a study by the Kaiser Family Foundation. As you can see, the employee-only coverage is about $5,000, and then employees are paying close to 20% of that, and the brunt of it is being paid by the employer, and you can see that for family coverage as well. If significantly higher as you'd expect, close to $14,000, with employees paying about $4,000 of that. Just to keep in mind, it really depends. The relation, I said that 9.5% of family income, but it's kind of benchmark. It really depends on your individual employee makeup of what their salaries are and to stay below that threshold. So now what's the penalty for not complying? Well, it depends where they're not complying. If they choose just not to offer coverage altogether to these full-time employees and their dependents, and they have at least one full-time employee receiving federal premium assistance, purchasing coverage through health insurance exchange, the employer is going to be required to pay $2,000 per full-time employee. Now, an employee is going to be eligible for this federal premium assistance if his or her income is less than 400% of the federal poverty level. Currently, that number is $88,200 for a family of four. Certainly, that number is probably going to go up by 2014, but I at least want to give you a benchmark of where that's at. Most likely, there are a lot of employees out there that are going to qualify for this insurance premium. Whether or not they choose to purchase it through insurance exchange is really going to be a cost analysis and how these insurance exchanges are set up. But it would be $2,000 per full-time employee. The first 30 full-time employees are excluded for purposes of calculating the penalty. What that means is, say you have 52 full-time employees, so you're required to comply with the pay or pay mandate. You decide not to offer coverage, so you're going to have a penalty. First 30 employees are excluded, so there's going to be a penalty on 22 employees, or a penalty of $44,000. Now, the other option of not complying, that was for if you offer coverage, or if you choose not to offer coverage. The other scenario is that you offer coverage, but it's considered inadequate, whether it be it doesn't provide the minimum essential benefits, or it doesn't cover 60% of the cost, or the other possibility is that it's considered too expensive for the employee, where it exceeds 9.5% of their income. If that's the case, the employer is going to be required to pay the lesser of $3,000 per full-time employee receiving this federal premium assistance, or $2,000 per full-time employee excluding the first 30 full-time employees. Again, whether they're eligible for that premium assistance is going to be 400% of the poverty level. Which penalty is applicable here is really going to be dependent on the employer size. Certainly, if it's a smaller employer, it's more likely to be this $3,000 penalty, but it really just depends on the given facts. But certainly, it can be costly. So that kind of covers the player pay mandate. Another provision of the bill is there's going to be no more reimbursements for most over-the-counter drugs under flexible spending accounts, health savings account, health reimbursement accounts. And this is actually effective this year, January 1st, 2011. And reimbursements may only be made for prescribed drugs or medicine. Insulin is one of the over-counter drugs that's specifically excluded that you can be reimbursed for without a prescription, and then non-medicine drugs such as medical devices. Again, this really is just a philosophical change from the prior administration with these consumer-driven health care plans. A lot of employees that use these are big proponents of it. The best thing you can do is really just explain to the employees that, it's not you as an employer that's making the change. There's been a change in law, and you're just complying with that. Along those lines, healthcare flexible spending contributions will be limited to $2,500, effective January 1st, 2013. This $2,500 limit is only going to apply to salary deduction contributions, which means if an employer wants to make contributions, it can exceed this $2,500 threshold. And this $2,500 limit will be indexed for inflation, so it will go up. Again, this provision is not effective until 2013. The best thing I can advise you to do is go ahead and tell your employees that this change is coming. Let them know. Again, it's not you. You're just complying with the law, and let them make changes accordingly. Because there are a lot of people out there that use these flexible spending accounts, and they're big proponents of it. So they realize, like as an employer, you don't want to make this change, but a lot of times the employee doesn't either. Another provision that's gotten a lot of press that a lot of employers are interested about is automatic enrollment for employees of large employers. What this means is that employers have to enroll their employees in the lowest cost health care coverage automatically upon an employee's hire. Technically, this should be effective immediately. However, statutory language indicates that the effective date is going to be dictated by future regulations. Unfortunately, we don't know exactly when that's going to be. Agencies have been so busy issuing other guidance that really haven't given us a heads up on when this is coming. We do know that it's going to apply to employers with more than 200 full-time employees. It's likely that this is going to be similar to existing concepts for 401k plans, for those of you that are familiar with that. Basically what this means is that upon employees hired, they're going to be automatically enrolled in this health care coverage, and then they'll give the option to opt out. And in that case, any premiums paid or anything like that will likely be returned. There's some type of grace period. Again, that's all speculation at this point. This is what we're assuming. But we really have to wait for future guidance to come out. Another provision that's gotten a lot of press is non-discrimination requirements for insured group health plans. This provision was actually supposed to be effective in 2011. At the end of 2010, the IRS came out and said they were pushing it back, that they were going to issue regulations. Those may come out in 2012, they may come out later. Again, we don't know. What we do know is it's going to be similar to the rules for self-insured plans that have had to comply with it for some time now. Those rules are extremely complex. It's a presentation in itself. That's a big reason why the IRS has come out and said they're going to issue additional guidance. Very generally, what this means is it's going to prohibit discrimination in favor of what's referred to as highly paid individuals. And generally, this is going to be the highest paid 25% of all employees. There are certain employees that are excluded. But the big thing about this is it's going to limit employers' ability to provide different employer subsidies to different groups of employees. For example, if you're compensating executives and management by subsidizing the cost of their health care more and having lower employees pay the brunt of it, or vice versa, it's likely that it won't be you won't be able to do that under these non-discrimination requirements. Again, that's speculation. We're waiting for additional guidance to come out. There may be exceptions provided in the regs, but most likely not. So the best thing you can do is start preparing for that, look at how it's structured, whether or not it's likely to be an issue, things like that. Another provision of the bill requires the cost of an employer-sponsored group health plan coverage to be reported on Form W-2s. This was originally supposed to be effective again this year, January 1st, 2011. They decided to push that back to apply to 2012 Form W-2s, which will actually be distributed in 2013. It's just reporting the aggregate cost of coverage, and it's rules similar to reporting the principal amount of COBRA premiums. It's not really considered this really isn't considered a big ticket provision. I just wanted to go ahead and bring it up in the presentation because I've had a slew of clients contact me about it. The thing I want to point out is that just because this information is reported on the W-2 does not make the amounts taxable. Employees will still be able to pay for their health care plans on a pre-tax basis. It's really just a reporting mechanism that the government can collect data. Again, one of the key things they're trying to look out for is this skyrocketing healthcare cost. They just want to be able to track it and see how it is affected, especially as a lot of revisions take effect over time. They'll be able to map out how it's actually affected. And it really is just a reporting mechanism. It doesn't actually mean the amounts are taxable. So I do realize a lot of provisions have been probably bad news for most employers out there. That being said, there is a tax credit for small businesses that hopefully is an option for many of you. And it was actually effective in 2010. And it's available to employers with fewer than 25 full-time equivalent employees and average annual wages of less than $50,000 per full-time equivalent employee. In order to be eligible for the tax credit, employers have to subsidize at least 50% of the employee-only coverage. And then the initial credit is up to 35% of the employer premium costs, subject to certain caps. As it's a phase-in credit, so as it gets closer to 2014, the amount of the premium will increase and it goes up to 50%. I did say that it's full-time equivalent employees, not just full-time employees. So if you're close to that 25 number threshold, don't just discount it and say, oh, I can't get this. It's definitely worth doing the calculation to see. The way you figure out how many full-time equivalent employees you have is take the total hours for which an employer pays wages to employees and divide that by 2,080. So essentially you're getting 2,080 hours for each full-time equivalent employee. And then whatever the answer is, you're going to round that down to the next lowest number. In addition, there are also certain employees that you can exclude, such as seasonal employees, a sole proprietor, partners in a partnership, more than 2% shareholder of an S corporation, and more than 5% owner. I really can't emphasize it enough that it's definitely worth taking a closer look at this provision, seeing whether or not you meet any of the requirements. One of the things you can do is, if you don't pay 50% of the employee cost of the premium, it may be worth it to make an adjustment so you can get it in the future. It could be that you just have to up it by maybe 5 or 10%, and then you can get this huge tax credit. It really can be a big money-saving device. It's definitely worth a closer look to see whether or not you can meet the requirements. So with that, having looked at those provisions, I'm going to kind of move on and then discuss what is the future of employment-based health care coverage. In order to do that, remember that before health care reform, one of the keys to group coverage was access, this guaranteed issue, that if you had group coverage as an option, you didn't have to worry about your previous health history, whether or not you were sick and had certain issues. There were subject to certain pre-existing limitations, but if you're going from one group coverage to another, that wasn't something you had to worry about. And now with health care reform, that guaranteed issue has kind of gone away. And so once access isn't an issue, employment-based health care coverage is really just another form of compensation. The best example of that is what's the value of COBRA continuation coverage after health care reform. And what I mean by that is the individuals that would typically elect COBRA coverage were the ones that needed the most and were concerned about having this gap in group health coverage and then developing some type of illness or something like that that would now be a pre-existing limitation once they received other health care coverage. Now that they don't have to worry about that, and they know they can just go get other insurance coverage and not have to worry about that, either purchase it through an individual or go to an employer, who's really going to do that? Why is it better to go through an employer? An employer can charge 102% of the COBRA premium, so likely it may cost them more to get COBRA than just purchasing it through the individual marketplace. So with that background, if it's just another form of compensation, how many employers are going to continue to take this administrative burden and liabilities of providing coverage? What we're seeing is a lot of employers are being proactive, and now that we know the excise tax will be applicable, they're doing a cost-benefit analysis. And they're really looking at it from a budget standpoint and saying, we don't know where health care costs are going. If we take the approach of, let's just go and pay the penalty and not provide the coverage, what is it going to cost us? In addition, you're going to have many employees entitled to this tax subsidy, so it further diminishes any contribution by the employer that the employees just really aren't seeing how much the employer is paying for the cost of coverage. If you go back to the slide that I looked at, the average cost in 2010 for employees only is around $5,000, and the employer was paying $4,000 of it. Clearly, this dwarfs the penalty, or the penalties dwarfed in compared to that, especially with healthcare costs going up. I'm not saying that you should do it. It's just one of those things that a lot of employers are engaging in to see whether or not it's really worth it, and kind of from a planning standpoint. So the big question is there a future for employment-based healthcare coverage? In the long run, no one really can predict it. I said earlier that we don't know where it's going. We don't know. I said that there is a constitutional challenge of whether or not this law is valid. We don't know if it's going to stick. It is a law for now, but even if it is valid, other legislation can come along and change it, so we really don't know. In the short run, there are several small employers considering just kind of getting out of the game, not really providing any health insurance at all, doing that cost-benefit analysis. Large employers, they're certainly doing this cost-benefit analysis, but what we're seeing right now is they're really concerned about any negative perceptions and the ability to attract talent if they don't provide it. Really, this is something that can change over time with perceptions. It really depends on the quality of the state insurance exchanges. It sounds great in principle that it's this online marketplace that individuals can go to buy insurance and compare it, but anyone who's actually purchased insurance knows it's not always easy to compare, especially when you get into different options like a PPO and HMO. It's just hard to put all the numbers on the same level and really compare apples to apples. So that's really what's going to dictate a lot of it. There are a couple things that employers should be doing now to help prepare. You guys should be ensuring that all the plans are complying with the new coverage mandates. Again, when we email out the slides, we're also going to email a table with all the provisions in the bill and the various effective dates. I would definitely advise going over that and looking at the terms of coverage, making sure that all the requirements are met. Another thing is evaluate impact of non-discrimination requirements. I did say that we're waiting on regulations to come out on what the specifics are, but you can go ahead and look at your cost structure, whether or not there is any type of discrepancy in the coverage provided to these highly compensated employees. And again, those are the ones that's generally going to be in the top 25% compensation-wise. You can go and start looking at just alternatives, see whether or not you're going to be impacted. Again, an insurance broker, talk about various options. Go and consider what you're going to have to do as far as either bringing lower employees so more of their coverage is paid for, or vice versa, bringing it down so the highly compensated individuals aren't subsidized as much. One of the things we see a lot is with self-insured plans that are already subject to these rules is that employers would just skirt around them. They would buy insured policy for their executives. Clearly, because the non-discrimination rules are going to apply, this really isn't going to be an option unless there's some type of exception in the regulations. Another thing employers can be doing is evaluate the impact of the play or pay mandate. Again, it's really just a cost-benefit analysis. I'm not saying that employers should do away with their health care plans, but certainly it'd be wise to at least know the implications, see whether or not your plans meet the requirements of what's considered adequate coverage, and know what the implications are of, dollar-wise, of what employers are going to be responsible if they don't meet those requirements. Another important thing to be doing is monitoring regulatory and other developments. As I said, many of the provisions are unclear or call for future regulatory guidance that's coming out all the time. It's important to stay abreast of it, see how it changes. And along those lines, from a legislative standpoint, the law can change. We really don't know what's going on. A lot can change if any new laws are passed. Along those lines, it's just be prepared for ongoing uncertainty and change. I realize no employers really want to hear that, but it really just kind of is the state of what's going on. It's important to be proactive and recognize the circumstances and try and act accordingly. And with that, that concludes my presentation. So I think we're going to go and open it up to questions.
Yeah, we're going to go ahead and open up the floor for questions. Thanks, Josh, for that great presentation. Just to let all of you know, the question and answer tab is the top left corner of your screen. So if you go ahead and select that, you'll see a pop-up box where you can type in your question and then select Ask in the top right corner of that screen, and your question will appear and we'll moderate as it goes. Just feel free to type in any of your questions. Josh is here to answer them. right, Josh, we have a question in here. It reads, is there premium deductibility for self-employed individuals different than the percentage allowance?
There really hasn't been a change as far as what's deductible in regards to self-employed employees. I'm not as familiar with the amounts that are deductible currently, but for self-employed, there really hasn't been a change in any of the rules.
Just to let you all know, Josh's email address and phone number is on there as well, so if you have any other questions outside of this presentation, feel free to contact him with those. Josh, we have a few more coming in.
Okay.
Can you elaborate on small employers getting out of offering health care?
Well, really, that's one of the situations that's going to depend on the individual employer and what their circumstances and the makeup of their employees. The thing that I'd emphasize is that under the play mandate, if they have 50 or less employees, they're not going to have to worry about complying with it. So they don't face the penalty of doing it. And with these escalating costs and the subsidies that are available to these employees, it may be that a large percentage of their workforce is available. They'll be eligible for these subsidies. It really just depends, but certainly you're seeing a lot of employers not willing to take the burden of the health care costs and the administrative burdens of compliance, and they're just exploring other options of allowing employees to purchase their insurance coverage through the individual marketplace. This is something we really see changing a lot in 2014 when these health insurance exchanges come online. Again, it's really going to depend on how they actually work as far as functionality. It could be a great principle, but like I said, sometimes it's tough for the average consumer to really compare different insurance policies. But certainly it's something that small employers are really exploring, just what their options are.
All right, and we have one more question coming in. Josh, can you name a good resource where we can get the latest updates as this issue develops?
I don't have the website offhand, but the Department of Labor has set up a website specifically for healthcare reform. I know it's DL.gov, maybe /healthcare reform. I know I said earlier about being cautious about what you Google, but it should be out there. I can also talk with the presenters about I'll see if I can find the website and send it out with the presentation slides.
All right, great. Well, thanks everybody for participating in our Q&A session. Now, just as we wrap up here, I want to thank you all once again for coming today and taking the time out of your busy schedules to participate with us. Just as a reminder, I'm going to be sending out the copy of Josh's presentation and the email follow-up. And along with this email, I'll be sending out a short survey to get each of your feedback on the program. And I'd really appreciate it if you filled it out and let me know what your thoughts were about what worked, what didn't, what you liked, and what you didn't like. And again, along with the survey and the presentation, I'm going to include a table that Josh provided with the provisions of the bill and the dates that are set to go in effect as that goes out. So again, I want to thank you, Josh Norris of Fisher & Phillips, for presenting to us today. And if you have any additional feedback outside of the survey, or if you have any questions for me, please feel free to send me an email at audrey@officearrow.com. Thanks, everyone, for coming and joining with us today, and have a great Thursday.
No, it's under my name. It would be 1012. Yeah, you do that. Okay? Bye. What a goof. What a goof.
Julie's helping hands is Sherry. Hello? Hello?